And good afternoon. Welcome to program number 50 of Ask the Governor with the 56th governor of the great state of Louisiana, the Honorable John Bel Edwards. He's been with us doing this program since April of 2016, and we are in May of 2020, and we know that we are in a new age, and the governor, of course, 65 days ago imposed a stay-at-home order, as did his colleagues across the country. And 5 days ago, the governor embarked on phase one of the comeback from COVID-19, with businesses now opening to some degree. And the governor is here to give his take on the world. Of course, we will talk with him about other matters, including legislative matters. And if you'd like to chime in, 877-217-5757. We wish to thank Jerry Mayer and Hometown Productions. They have been with us since day one. So this show is not only a radio presentation across 3 states, but it also is a television production seen in many markets across Louisiana. Governor John Bel Edwards, good afternoon to you.
Thank you, Jim. It's great to be back with you and all of you listeners across the state. And I'll tell you, it has been a very difficult time, not so much for me, although it certainly hadn't been easy, but for the state and particularly for those individuals and families who've been directly affected by the coronavirus and our frontline heroes, the medical professionals, doctors, nurses, respiratory therapists, EMTs, and paramedics. You name it, just have done a tremendous job. I did want to start today, Jim, by just giving the update that I would typically give at a press conference on testing. So today at noon, we reported 278 new cases across Louisiana. That's on 7,897 tests. So that's a positivity rate of about 3.5%, which is relatively low for us and in light of many other states as well. And we're reporting, unfortunately, 27 new deaths across the state from complications related to COVID-19, a total now since the public health emergency started of 2,485 deaths. The really good news we have is that the number of people hospitalized across the state of Louisiana for the first time since March the 28th is under 1,000. And in fact, it's 931 today. And to put that into perspective, just over a month ago, we had 2,134 individuals in the hospital from COVID-19. Ventilator usage also continues to go down. So we've made tremendous progress over the last 2 months. 2 months ago, we had the highest growth rate, the steepest growth rate in COVID-19 cases anywhere in the world, according to Johns Hopkins data. And we really have turned that around in the state of Louisiana. And so I want to thank all of the people out there who've taken this seriously. They took the stay-home order seriously. They took the hygiene measures seriously, the social distancing. And I do believe we can re-engage more of the economy, open more of our businesses, get more people back as employees and as customers, and do it safely. But that's only if we continue to social distance and practice good hygiene, wear the mask when you're out in public and not just with members of your immediate household. And so, anyway, we're in a pretty good place. And, Jim, you mentioned about phase one. We did start that on Friday. I would point out that unlike many other states, in fact, every other state that had anywhere near our per capita cases, we never closed manufacturing. We never closed construction. We embraced the full range of CISA guidance when it came to essential infrastructure, so we left those open without restrictions. And we never closed non-essential retail, and we left those stores open. So we do have the benefit of not having closed down as much of our economy to begin with as many other states. And now we're in phase one of the president's plan. It's a phased approach to reopening. As you know, the order goes until June the 5th. It's my hope that we'll be able to move to phase two at that time, but that'll depend on the data that we collect between now and then and whether we continue to trend in the right directions. But we're doing much better.
When will you make the decision on whether to go to phase two?
Well, so I hope that it's sometime right around June the 1st, because what I'd like to be able to do is communicate that to the state several days ahead of whether we go or we don't go. And of course, so that means we make, if Friday, June the 5th is a Friday. So my goal is to be able to make a decision very early in the week, Monday or Tuesday, and announce that decision. And again, I hope to be able to move forward into phase 2. It'll depend on what cases are doing. Right now, they're moving in the right direction. We do have some concerns up in regions around Monroe and over to the Shreveport-Bossier area, but those are very, very small case counts that we're talking about. And overall, we're continuing to move in the right direction. The challenge, as you know, Jim, and I hope the listeners can appreciate, it takes 7 to 10 to 14 days after you get more movement among the people, more contact. If there's going to be case spikes, it takes that long for them to show up. And that's why we need to be patient and get the data. But we also need to make sure that we're doing our part by following all the guidance that we're putting out, all of which is very consistent with what the White House has asked us to do, and the CDC, by the way.
We have about a minute before we take our first break, but you did make a trip to the White House since we last visited. How was that experience?
It was a great trip. I spent about 90 minutes with the president in the Oval Office and the first string of the White House Coronavirus Task Force. So the vice president was there, Dr. Birx was there, Dr. Fauci was there, obviously the president. And they had been watching Louisiana very carefully. They knew that we had the highest growth rate anywhere in the country, anywhere in the world. And I will tell you, they were very complimentary of the people in Louisiana, especially the local leaders, for the very bold decisions and timely decisions that were made, but then the compliance by the people in order to flatten the curve. And so it was a great visit, and they committed the support that we need to get our 200,000 tests per month starting in the month of May, and we're on track. And so I think having those communications is critically important for our state, and I was very happy they invited me to come up to Washington.
Let's start with Ann in New Orleans. Ann, good afternoon. You were on Ask the Governor.
Governor, first of all, thank you for the wonderful updates you give. They're clear, comprehensive, and well-reasoned. My question concerns the regions. Can you discuss the criteria that were used to establish or define the various regions in the state for data reporting?
All right, Governor. Matt, can we push up the governor here? Governor Edwards, what about the regions and how they are defined?
And for calling in, Jim, you still have me, huh?
I do.
Okay, I wanted to make sure. So, Ann, thank you. So the regions that we report by as it relates to this public health emergency are the Louisiana Department of Health regions. And those regions were established long ago as a way just to have an organizational structure to the Department of Health so that we could break the state into various geographic areas, have regional medical directors, facilitate the communication with hospitals, health clinics, health centers, all the various healthcare providers, and then also to administer our Office of Public Health, which is what we're using it for primarily today. So, for example, in Region 1, that's Orleans and Jefferson parishes, but also St. Bernard and Plaquemines. And then Region 2 is over in the Baton Rouge area. Then you get back to Region 3, which are the areas around Terrebonne and Lafourche parishes and some of the river parishes between Baton Rouge and there. Region 9 is what you would call the North Shore. But it really is just a way for us to organize healthcare in Louisiana, similar to the way, for example, the state police has various troops around the state that allow them to have those local commanders that can better communicate with sheriffs and chiefs of police and the public and so forth. So that's why we organize in that fashion. And one of the things that we do is we look at all the data in this public health emergency, first of all, statewide, then by region, and sometimes down by parish. And sometimes we even get below the parish, and we go to different congregational settings, congregant settings in these parishes. So maybe it's a nursing home, a jail, or a prison, things like that. But that's how we're organized. That's how we're looking at the data and making our decisions. 877-217-5757 for Governor John Bell Edwards.
Thank you, Ann in New Orleans, listening to WWNO. We go to James in Longview, Texas, one of our frequent callers. He says he's listening online to WRKF. James, you're on the air with the governor.
Good afternoon, Jim, and good afternoon, Governor Edwards.
Thank you, James.
Anyhow, at least we're social distancing. Anyhow, I commend you on your steady hand during this COVID-19 crisis. I was just reading in the newspaper about casinos in Louisiana being affected, and I know they're a center of tourism and really a magnet for economic growth and everything, and I just want to kind of get your opinion. I heard of one possibly closing around Bossier. Do you think you'll be able to stem the tide, or hopefully it won't get worse? I just want to know about that.
Well, James, thank you very much. And so gaming establishments were included in Phase 1. Even though Phase 1 started on Friday, they couldn't open before Monday because they had to have their individualized plans approved by the Gaming Control Board. They were limited, like other businesses, to 25% occupancy, but within these establishments, they also must social distance. So gaming positions are limited to 50%, and you can't have two gaming positions open right next to one another. So that you have contiguous gaming positions operating at the same time. So we're not allowing that. And I'll tell you, James, the decision that was made in the Bossier area by the company there that owns and operates Diamond Jacks, that actually was a decision that's been coming for a couple of years. What happened was that market, I believe they have 5 licenses for casinos in Shreveport and Bossier. And at the time those licenses were awarded, you didn't have all of the competition that you now have in that area, especially up in Oklahoma on the Indian reservations. And so they were drawing from Texas, and I know you're from Texas, from Arkansas and from Oklahoma. But then once Oklahoma allowed its Indian reservations to start gaming, then the market really won't support all 5 of those licenses. And a study was commissioned by the legislature, and last year it showed that really 2 of those 5 licenses ought to be relocated in order to maximize the revenue that the state derives from those licenses, and also to stabilize that particular market. So while the casinos were closed because of the pandemic, and they made the decision during the closure that they're not going to reopen, I will tell you that decision had more to do with the market changes than with the public health emergency.
Stephen in Baton Rouge, listening to WBRP. Stephen, you are on Ask the Governor. Hi, Stephen.
How you doing this afternoon? I have a comment and I have a question. And I come with a heavy heart. And let me just say I'm a man of faith like yourself, Governor. And I lost people close to me. And this is a really concern of mine. I called television stations in Baton Rouge 3 months ago and told them about the situation in nursing homes. They all need to be tested in nursing homes and veteran homes. And I lost several people I actually take care of in homes. Secondly, I've had seniors come to me point blank and said they cannot get testing because these seniors can't navigate a computer. They don't have a computer. They don't have the kind of cell phone. We need to get out there a thing for the seniors, a system, so where they can call on a regular phone, a landline phone, and get these people tested. Thirdly, we have a lot of people out there. You say.
All right, Governor, would you respond to Stephen in Baton Rouge?
Yeah, and I will. And first of all, Stephen, obviously I'm very sorry for whatever losses that you've experienced, and I know that we've been grieving for each of the 2,485 people who have died. And as you rightly mentioned, the seniors are most vulnerable, and that's the way this has played out all across the world. There's a marked difference between those who are under 65 and those who are over 65 as to how they're able to withstand and deal with the disease if they contract it. And then, of course, you have other people with chronic health conditions who are also more vulnerable. And I will tell you, we are working with nursing homes. A number of them now have done 100% testing, not just of residents, but also of staff members. And we're working to implement a plan. As you know, we're increasing our testing to 200,000 in the month of May. A big part of that has to do with ramping up our capacity for areas where we have hot spots, rural areas where there's been inadequate testing all along, and then these congregate settings like nursing homes. And so we're working with nursing homes in every region of the state. A number of them have been tested 100%. Others will soon be, because it's a directive that I have issued. And then we also have drive-up testing that we're making available, mobile testing that we're sending to various communities across the state of Louisiana. And we are looking to partner with various entities to help us cover the entire footprint of the state of Louisiana and get all of this testing done, because this is not going to stop anytime soon, over the next several months at least. And that will include in-home testing for seniors, especially those who already are part of some sort of a program where they're receiving care in their homes, potentially receiving services through the councils on aging. So we're working all of those angles, and you're right to be concerned. I will tell you, we've been talking about the most vulnerable people being those who are elderly and those with these chronic health conditions, and we're doing everything that we can to expedite the testing for these individuals as we ramp up our capacity. And I will tell you, because I don't know if I mentioned this earlier, we are on track presently to get to 200,000 tests administered in the month of May. And we still got some work to do, and the federal government is resourcing those test collection kits with swabs and viral transport medium, but we believe we're going to get there. And I just wanted to give you that report, Stephen, but thank you for your call.
Donna in Lake Charles. Good afternoon, Donna. You're on the air with Governor Edwards.
Hi, Governor Edwards. I first wanted to say I think you're doing a phenomenal job. My question is, when are the juvenile facilities going to be open for visitation, both secure and unsecure? Because these children haven't seen their families in months.
Well, first of all, that is a great question, and it's not just the juvenile facilities. One of the first things that we did upon recommendation, I don't know if you'll recall, but a couple of months ago, Jerome Adams, who's the U.S. Surgeon General, Dr. Jerome Adams, was actually in Louisiana. And during that visit, he brought to us recommendations from the federal government as to how we minimize the spread of COVID-19 in these congregant settings that we've been talking about. And we were talking specifically about jails, prisons, nursing homes, and other areas like these juvenile homes that you mentioned. And so one of the things that we did is, except under very rare circumstances, we discontinued visitation. Now, we have tried to make phone time more available in the correction settings with adults and with juveniles, FaceTime and that sort of thing. And we know that there is no substitute for an actual visit, face-to-face, and so forth. And we want to be able to resume that as soon as we can when it's going to be safe. I will tell you, I got a report this morning from Dusty Bickham, who is the head of the Office of Juvenile Justice. At one time, we had 32 youth who were positive for COVID-19 that were in the custody of the state. Today, we have none. All recovered. None needed to be hospitalized, and so we're in a pretty decent place right now with respect to our juveniles. We do have some staff members who continue to be out in the Office of Juvenile Justice, but we got a very good report today from them. And I'll get with the Department of Health and Office of Public Health and talk about this particular setting and see when we might be able to reinstate visitation. And it's something that I'm getting questions about with respect to nursing homes and hospitals too. But I will tell you, there's still a lot of COVID in our state. Just over 2 months ago, or 2.5 months ago, I guess it was, we had one case. Today, we know we have over 9,000 active cases, and that's just by the testing. About 25% of the people, we believe, coming from the CDC, 25% of the people who have COVID-19 don't know they've got it. They're asymptomatic or very mildly symptomatic. They typically don't get tests, yet they can be contagious. And so that's what we're trying to guard against, and we know that it's a hardship. We know in particular with respect to juveniles that it's counterproductive because we really want them to have a therapeutic setting. That by definition means we want them to have contact with their family members. So we won't maintain this any longer than we think is necessary. But all these decisions that I have to make while we have a public health emergency, are just very, very difficult decisions. But Donna, we will revisit that particular one, and I can't promise you anything right now because I just don't have the benefit of the counsel of the folks at the Office of Public Health and Juvenile Justice yet.
We're halfway through the hour with Governor John Bel Edwards on show number 50 of Ask the Governor, and we will return with another half hour of your questions. We'll start with Mary in Lafayette. Then.
Good afternoon, Governor, and thank you for taking my call. And I am a lady who is blind here living in the Lafayette area, and I'm happy to tell you that I appreciate your opening all the churches, and especially I being a Catholic and a daily attendant at Mass. I've really appreciated that. This is my question, though, to you today. While I've been very welcomed in all of the churches and different places where I've gone, even to my hairdresser, I ran into a little problem because I'm trying to use here in Lafayette one of our branch libraries. And the library's manager felt like, well, because of the 6 distance rule, I have to have someone attend the library with me, but I really go on my own. I take a special bus for the disabled here and go to the library. And I try to work with the computer at the library and just enjoy the services. I did approach the mayor by way of a letter to express myself because I started thinking, I know that I need help when I walk in the library. Sometimes someone takes my elbow and will guide me to the computer stand or whatever station. But they're worried, of course, about all this touching. However, like I said, everybody's simply got sanitizer. If my elbow, in my touching their elbow, is dirty or something, they could always dab their arm with Purell.
All right. Governor, would you respond to nice lady Mary in Lafayette?
I will. Mary, thank you very much for calling. And I will tell you, my mother is an everyday Mass goer, and she, too, is very happy about the fact that churches are open. They technically were never closed, but we put a limit of 10 people during the stay-home order, and obviously that was not conducive to a lot of people getting to church. And so a lot of people are going back out, and I'm glad we were able to do that. Mary, I'm going to ask you to stay on and give us your number, because I want somebody from my Office of Citizens with Disabilities to give you a call to specifically talk through this. I'll get Bambi Polizzola to give you a call. She is from the St. Landry Parish area, but she runs that office for me, and we'll figure this out, because if it's an issue for you, it's an issue for others too. And I want to make sure that you're able to get out and enjoy the use of the library and the computers there and whatever other services that they provide, and do so in a way that's safe for you and safe for others. And there just has to be an accommodation that can make that happen. So if I can get your number, I'll make sure that we call you back and that we deal with this.
Penny in New Orleans. Penny, good afternoon. You're on the air with Governor John Bel Edwards. Hello, Penny.
Good afternoon. Good afternoon. Hello, Governor. I'm a big fan of yours. I voted for you.
Thank you, Penny.
Okay, thank you. You have publicly expressed concern about racial inequities during the current crisis. Research has shown that air pollution worsens COVID outcomes. Would you use your authority as governor to shut down air pollution from companies such as Denka and St. John Parish and prevent new polluting industries such as Formosa and St. James in communities of color that are disproportionately impacted?
All right. Can you pull up the governor, Matt? Governor John Bel Edwards responding to Penny. We need to pull up the governor on line 6. There we go. Governor.
Oh. And obviously I'll continue to work through the Department of Environmental Quality to make sure that the industry that we have in Louisiana complies with the limitations that they have, consistent with their air permits, but also their water discharge permits and so forth. You do make a valid point. People with breathing difficulties, any sort of respiratory illness, including asthma, do make them more vulnerable to this disease than others. And we did create the Health Equity Task Force to address the situation in Louisiana, where we know, for example, that while 32% of our state's population is African American, currently we're showing that 55% of the deaths associated with complications of COVID-19 are among African American individuals. And so one of the things we're trying to do is to figure out exactly why that's happening. We think it has something to do with the comorbidities, that there's a higher prevalence of kidney disease, heart disease, hypertension, diabetes, that sort of thing in that population. But also, is it that more African Americans are actually contracting the disease to begin with than their percentage of the populations? And so we've got a lot of work to do, and we're going to get that done. And but I will tell you, we're going to make sure, as we always do, that industry complies with the legal requirements that they have to comply with respect to their permits.
Let's go to Charles in Mandeville. Charles, good afternoon. You're on Ask the Governor with Governor John Bel Edwards. Hi, Charles.
Hey, good afternoon, Governor. I really appreciate the job that you do, and I couldn't be prouder. Two-pronged question. Recently saw a map of orphaned oil wells in the state, and I noticed that they are attempting in the state legislature to put forward some legislation to shield oil companies from being sued for restoration or damage to the environment. And the second part of my question is, at what point of the oil price per barrel are we looking for to stabilize the state budget projections in the future?
Yeah, well, Charles, thank you very much for the call. So the price per barrel that I believe the economists settled at for the forecast for the fiscal year that starts on July 1st is $52. I'm sorry. That's the old number. It may be $33, and of course that's a average across the year. So it can be lower than that, it can be higher than that, but that's the average amount. Clearly, in order to get that sector of our economy performing and get more people back to work and the investment coming in and the capital coming off the sideline, it's got to be at least twice that of $65 a barrel if we're going to see that. And unfortunately, we were getting into that range several months ago, and then supply issues, demand issues, then COVID-19, the dispute between Saudi Arabia and Russia over output and so forth really hammered that particular sector. With respect to orphaned oil wells, that is a real problem across Louisiana because we have a number of them that are just abandoned, as the word orphan would sort of indicate. And then it's up to the state to go in and close them down, and you have to have the money to do that with, and the stream of revenue available to DNR and the Office of Conservation for orphaned oil wells is really inadequate. We've known about this problem for a while. We're trying to come up with a solution, but I will tell you, it has not been an easy solution to find and to fund.
Now, Governor, I understand there has been a choice made for the post of Superintendent of Education, and your thoughts about Cade Brumfield, the person selected to succeed John White.
Superintendent of two districts, and this is what I think makes him particularly appealing as a choice. One of those districts is DeSoto Parish, a relatively small rural parish in North Louisiana, but currently he's the superintendent of the most populous parish, one of the most populous parishes in the state of Louisiana, and that's Jefferson Parish. And he has worked with traditional public education people. He's worked with reform folks and charter school folks, the Jefferson Parish Chamber of Commerce, and so forth. And so I'm first of all, I'm excited about his selection. The Bessie Board did a good job of having a very transparent search and selection process, and they maintained the timeline that they set, even though we had this public health emergency. So I want to commend all the members of the Board of Elementary and Secondary Education. I congratulate Dr. Brumley, and I look forward to working with him. You know, education is going to be more difficult because of this public health emergency, but it's never been more important. And we've got some decisions we have to make really quickly going forward, and I look forward to working with him on that.
39-year-old Cade Brumley, Jefferson Parish Schools leader, has been named Louisiana Superintendent of Education. Your number is 877-217-5757. We'll try to get Donald's question in, and then we'll go to the governor when we return from a short break. But Donald on line 2, I believe it is, Matt. Donald, good afternoon. You're on with Governor John.
Yes, good afternoon. How you doing,
Yes,
Governor? Thank you, Governor, very much. I think you've done a tremendous job, and I know it's been stressful, and we thank you for what you have done and what you're doing.
Well, thank you very much, Jim. And Donald, thank you for calling. Obviously, it's very difficult, and Donald's talking about the effects that he's still feeling from a natural disaster. We're accustomed to those, although we obviously don't like them. We're accustomed to them. We kind of know what to expect, and at some point you're past them. This is very different because it didn't play out over a day or two, and then the water recedes. This public health emergency with this virus and this disease is very, very difficult. But the one thing that's consistent is the people of Louisiana are very resilient and resourceful. We know how to be good neighbors to one another. Now, if memory serves me with respect to Donald, and I do hope that somehow we were able to get his number, I think he's called in on the program before, and I was able to look into his Restore file and see what the issue was, and I believe that we were able to communicate with him. Obviously, it hasn't been rectified to his satisfaction. I'm not sure that that's possible because, quite frankly, my memory doesn't serve me as to exactly what the issue was. But Donald, if you're still listening, if you can get your number to me, I will ensure that someone calls you back with knowledge of your particular file. And in the meantime, I'm just going to give you the number to Restore Louisiana, which is 866-735-2001. There are not a lot of files left open that are working because that program is just about complete at this point. But I do want you to call, raise your issue, and see if there's any assistance. And if you'll get your number to me, I'll make sure that someone follows up with you.
Governor, on Monday, the Louisiana Senate on a 29-8 vote advanced Senate Bill 418, the Omnibus Premium Reduction Act. It would dramatically change how people injured in car wrecks can seek and receive recompense through our state courts. Your thoughts about what you know to this point regarding this legislation?
Well, it's a bill that's very similar and maybe identical to one that was filed last year, also by Kirk Talbot. At that time, he was in the House. Now he is a new senator. It actually contains a provision that I filed when I was a member of the House many years ago. Oddly enough, that provision was at that time opposed by the insurance industry in Louisiana. So there are some parts of the bill that I know can be agreed upon by multiple different stakeholders and members of the legislature. There are obviously some parts too that are problematic. I happen to believe that it's possible to have a compromise on that bill that would achieve most of what Senator Talbot wants to achieve, but without some of the provisions that are most disagreeable to some people. And we're working to see whether that's possible. You know, it's even though there's only 10 days or so left in the legislative session, that's plenty of time in order to make something happen. Kirk Talbot and I get along very well, and I'm going to be meeting with him soon to have a conversation and just to see what we can do going forward. I think everybody agrees we pay too much for insurance in Louisiana with respect to our automobiles. I will tell you that one of the things we should do is on the regulatory side. We simply shouldn't allow insurers to charge blue-collar people more than white-collar people, females more than males. They should not be able to charge poor people more because they have a poor credit history when they have a superlative driving record. And those are the sorts of things that we should be able to do and all agree upon. I think they would lower insurance premiums too. So it's a work in progress, and I try not to negotiate through the press and that sort of thing. But I can assure you, there's a lot of people in the legislature working on this issue, trying to come to a successful resolution.
Is it a prudent move to suspend any legal action against the oil and gas industry for damage to the coast? Is that a good move at this point?
Yeah, well, I don't understand that that's what the bill does that you're referring to. It would tell the local governments, the parishes that of the coastal zone, that they would not be able to bring the lawsuits that they have been expressly authorized in state statute to bring, and those lawsuits actually were filed going back 7 years ago, before I became governor. And this would retroactively divest them of the authority to maintain a suit that they filed pursuant to a statute that gave them that authority expressly. And so, no matter what your views of the merits of the litigation, it's not something that we would typically do, to go in and say, yeah, we know we told you could do it. We authorized it. You did it. You've expended this money and you spent all this time and effort. But we're going to say going forward, you can't maintain those suits. That to me is not an appropriate way to try to resolve this matter. And quite frankly, I have real difficulty with that. And we'll see whether that bill makes it all the way through.
Rosalind in New Orleans. Good afternoon, Rosalind. You are on the show with Governor John Bel Edwards.
Thank you. Hi. My husband and I are both 81 and we're veterans. And the VA hospital in New Orleans is closed. I was wondering, can we just go to any hospital in town?
Governor, I'm not sure you were able to hear Rosalind. She says she's 81, her husband's 81, and the VA hospital in New Orleans, she says, is closed, and she would like to know about other options.
Okay. First of all, thank you very much, Jim, because I could not hear her. So I was trying to figure out what I was going to do to answer her question. If I can get her number, I will make sure that someone from the Louisiana Department of Veterans Affairs gives her a call. Quite frankly, I didn't know that the VA hospital in New Orleans had closed. I have pretty frequent communications with them, and even with the VA secretary in Washington, who happens to be someone who has lived in Louisiana, and he still has family here. But I have not heard that, so that's news to me. We do have clinics that are around as well, VA clinics in addition to the hospital. But I will get, if there's any way, Jim, for me to get Rosalind's number, I will make sure that she gets a call and we can coordinate her care and her husband's care.
All right, time to get in a call or two for the governor in our remaining time with him. Let's go to Amin in New Orleans. Matt, can we slide Amin on the air with Governor John Bel Edwards? Hi, sir.
No,
I'm sorry. I'm sorry. It is a lady.
How are you?
I'm doing fine. I apologize. Amin.
No problem. Thank you very much, Governor Edwards. In my opinion, your leadership has been exceptional. I just wanted to relay a situation that I have. I'm 68. I have an autoimmune illness, and my mother is 96. And I'm taking care of her. She requires total care, is non-ambulatory. She is on hospice at home. And since March 13th, I stopped all traffic in the house. So aides could not come and bathe. Nurse could not come and examine. And I've had teleconferences since that time. Food is brought to us from family and friends. So I recently learned that the hospice wants to continue personal access on Monday. I'm not comfortable with that because they and I need to have some kind of evidence that my mother, especially my mother, will be protected.
All right, Governor, would you respond to Amen in New Orleans?
Yeah. Thank you, Amen, and I appreciate the call, and I know that's a very, very tough situation, hospice anytime for a loved one, but you are right to be concerned. Both you and your mother are in the vulnerable category, her on the basis of her age, you on the basis of your autoimmune issues. I would just tell you, you need to be comfortable. I would call the hospice company and make sure that they have tested the employee, for example, that they're going to adequately use PPE and the hygiene practices and so forth. But if at the end of the day you're not comfortable and the arrangements that you've been under there since March the 13th, if those are satisfactory to you, then I would urge you to continue those. I will tell you, without getting into detail, I have a similar situation going on at my house right now. We do have occupational therapists and other therapists and medical professionals coming in, but that's our comfort level, and we did take a number of precautions. But at the end of the day, you have to be comfortable with the situation, and so I would just call them and have that discussion with them, and then you make the decision that you think is best for you and your mother.
Well, Governor, thank you. Show number 50 is in the can, and we hope you and your family have a good Memorial Day. Thanks for your service to our country, and to those who lost their lives, we remember them come Monday. But Governor, I appreciate you coming in today, and obviously we're doing social distancing, but hope everybody enjoyed the program, and we'll be back third Wednesday of next month. So until then, for Governor John Bell Edwards, I'm Jim ENGSTER. Thank you for listening to Ask the Governor, and stay tuned.